How do I know if I have a bladder infection? Ever had that uncomfortable feeling of having to go to the bathroom even after you've already gone? Or how about a burning sensation during urination? It all sounds really unpleasant, and let us tell you, it is. Anyone who's suffered from a bladder infection can attest to that. Bladder infections are caused by a bacterial infection that inflames the bladder. Unfortunately for women, they're more prone to getting them because of the location of our urethra and the fact that it is shorter. In fact, most women will have suffered at least one bladder infection by adulthood. And even though the odd bladder infection is unserious, quick action is needed to treat it immediately before it spreads to the bloodstream or kidneys. Here are 14 common symptoms that could indicate you're suffering from a bladder infection. 1. Lingering urge to urinate. The frequent and sudden uncontrolled urge to urinate, even after you've just emptied your bladder, is a very common sign of a bladder infection or a urinary tract infection, or UTI, as some doctors refer to any bacterial infection in the urinary tract, including the kidneys, ureters, urethra, or bladder. With a bladder infection, bacteria enters the body through the urethra and travels into the bladder. Typically, the body will work to eliminate the bacteria by emitting germs during urination. However, if the bladder is overrun with bacteria, and more specifically, if the bacteria attach to the walls of the bladder and begin to multiply, the body will become overwhelmed with too much bacteria to eliminate it effectively. However, with a bladder infection, the body may increase urine to attempt to eliminate excess bacteria. 2. Urination that disrupts sleep. The urge to urinate at night can be so strong with a bladder infection that it rouses you from sleep and disrupts you several times throughout the night. You may wake frequently throughout the night with the urge to pee, but only do so in small amounts, despite the fact that it feels like you're holding a lot of urine, and even when you urinate, you will likely still feel the pressure and weight, as if you didn't completely drain your bladder of urine. As you fight a bladder infection, it's vital to drink plenty of fluids. Water and herbal teas are best, in an attempt to flush the bacteria out of your bladder. Your doctor may also recommend drinking cranberry juice to increase the acid levels in your urine, which may speed the destruction of bacteria. However, as you increase your fluid intake, you will likely find you have to urinate more often, especially throughout the night. 3. Blood-tinged urine. If your urine appears cloudy or contains traces of blood, you probably have a bladder infection, especially if your urine smells foul. If you visit your doctor complaining of cloudy, bloody, and foul-smelling urine, as well as pain when urinating, and the frequent pressure to empty your bladder, your doctor will likely suspect a bladder infection or urinary tract infection. A doctor will use a test, called a urinalysis, to diagnose a bladder infection or UTI. During a urinalysis, a sample of urine is taken and examined in a lab for the presence of bacteria, nitrates, white blood cells, red blood cells, and specific chemicals that indicate a bladder infection. A doctor may also use a test, called a urine culture, to specifically pinpoint the type of bacteria in your urine, and make a proper antibiotic prescription. 4. Burning upon urination. A painful burning as you urinate is one of the most common symptoms of a bladder infection. When not urinating, your bladder may feel heavy and achy as well. Women are more at risk for a bladder infection or UTI compared to men for basic anatomy reasons. For instance, women have shorter urethras, meaning the path to the bladder is much more convenient for bacteria to travel and infiltrate. In addition, women have urethra that are closer in location to the rectum compared to men. This leaves females more at risk than men for bacteria infection, because again, bacteria has a shorter distance to travel. Any urinary tract abnormalities, such as blockages, obstacles, a recent surgery, a narrow urethra, pregnancy, or the use of a catheter, can all increase the risk of frequent and reoccurring UTIs. 5. Fever. For elderly or child patients, a bladder infection may cause a heightened temperature along with chills. This is a sign that the infection has spread to the kidneys. It's common for any infection to cause a mild to high fever as your body attempts to fight off foreign invaders. In fact, many folks with urinary tract infections are prompted to go to their doctor due to a fever. Bladder infections are treated with prescription antibiotics that are taken orally to kill the bacteria. Typically, a fever will not last long. As soon as the bacteria causing the bladder infection starts to be killed off, your body's immunity will be stronger and begin to gradually lessen symptoms of fever, heavy bladder, bladder pain, and the burning sensation you feel when you urinate. 6. Exhaustion, fatigue, and lethargy are common with bladder infections, particularly in elderly patients or those with compromised immune health. It might also indicate the bladder infection has developed into a more severe urinary tract infection, UTI, which can affect the kidneys, bladder, uterus, or urethra. Whenever the body becomes overrun with bacteria, the immune system will focus energy on fighting the infection off. This is one reason you often feel exhausted when sick. Another reason why you may feel fatigued when battling a bladder infection is dehydration. As the body attempts to eliminate bacteria from the body via urine, you will urinate more frequently and the amount of urine with each bathroom visit may increase. This is why keeping your fluid levels up as you battle a UTI is very important. Sip water and herbal teas in an effort to produce more hydration and flush the bacteria out of the body faster via urination. 7. Inflammation. A bladder infection results in a painfully swollen bladder and urethra, which causes pain and a constant weighted sensation in the lower abdomen. Bladder infections, or urinary tract infections, are the result of bacteria that travels from the urethra to the bladder, attaches to the bladder walls and begins to multiply. The result is cystitis, what doctors refer to as inflammation of the bladder. If your doctor diagnoses a bladder infection, he or she will typically prescribe oral antibiotics in attempts to kill the bacteria that are causing the bladder inflammation. In the meantime, you may experience several side effects of an inflamed bladder, including a heavy feeling in your abdomen, pain and burning sensations when you urinate, and an increased urge to urinate. 8. Bedwetting. Young children and elderly patients with bladder infections will often be unable to control their bladders, particularly during sleep, which may result in embarrassing bedwetting. This bedwetting can be very embarrassing. However, the urge to urinate may become more frequent and pressing as the bladder infection worsens. This may mean you have the urge to urinate suddenly in your sleep, and may be unable to make it to the bathroom in time. The sensation that occurs with a urinary tract infection can differ from person to person. However, many characterize a bladder infection with a weighted feeling in the abdomen, or bladder, that causes a frequency and sudden urge to urinate. This may occur during the night, especially if there is any pressure placed on the bladder. You may also feel a burning or tingling sensation when you urinate, and urine may smell foul and be tinged with blood. 9. Back pain. Lower back pain is common with serious bladder infections if the bacteria enters the bloodstream or spreads to the kidneys. This is due to the location of the bladder in the body. Our bladders are a muscular sac that's situated in the pelvis, just above and behind the pubic bone. When the bladder is empty, it's about the size and shape of a pear. However, when the bladder is full and inflamed, as is the case with a urinary tract infection, the size and pressure of the organ can press on the pelvis and even cause pain and pressure in the lower back. This is why when diagnosing a bladder infection, your doctor may ask you if you have any pelvic area discomfort as well as pressure or pain in the lower abdomen and lower back. Your doctor may also press into your lower abdomen gently to explore the area for pain and signs of inflammation. In addition to a physical assessment, your doctor may also give you a urinalysis, to examine a urine sample for traces of bacteria and other foreign germs. 10. Foul smelling and discolored urine. Ever notice that pee can sometimes have a bit of a smell after drinking lots of coffee or eating lots of asparagus? Don't lie. It happens. It also occurs during a bladder infection. According to Women's Health, the urine that has come from an infected bladder will have a strong odor to it that smells like ammonia. In addition to having a bit of a strange smell or even blood in the urine, a bladder infection can cause cloudy pee. Usually our urine is a light yellow color depending on what you've been drinking, water, juice, or coffee, but when the urinary tract is fighting off an infection, it can cause pus, containing dead skin cells, bacteria and white blood cells, to appear in your urine, giving it a cloudy or murky appearance, explains Health 24. 11. Bladder leakage. Bladder leakage is only common in older women. Most people who have a bladder infection will experience one or more of the other symptoms on this list. Women who've gone through menopause are at a higher risk for developing a bladder infection because of their decrease in estrogen. They are also more susceptible to asymptomatic infections, with more bad bacteria in the bladder but no pain or fever, says Women's Health. Leakage is one of the symptoms that might bring them in, and when we're checking we'll find a UTI, says Jessica Shepard, MD, a Chicago-based OB-GYN when talking to Women's Health. Women can't sense when their bladder is full, and when you let urine sit there for too long you can get infection. 12. Shaky, tired, and the chills. If you're experiencing flu-like symptoms along with a bladder infection, it could mean the infection has traveled into the kidneys, which is much more serious. Healthline writes, a kidney infection will often cause fever, chills, nausea, and vomiting. You'll typically feel quite ill. If this is the case, seek medical attention right away. Kidney infections are serious. Women's Health adds that these symptoms could be a sign of sepsis, which means it's affecting your organ systems and is in your bloodstream. This is also a serious complication. If you feel shaky, tired, and have the chills, along with the other symptoms on this list, go to the doctor. 13. Sore abdomen. In addition to back pain, someone who's suffering from a bladder infection will also experience a sore abdomen. Cystitis occurs when the bladder becomes inflamed from an infection, and one of the most common signs is sensitivity in the abdominal region. Pressure on your pelvis, particularly around the pubic bone, can cause some serious discomfort, especially when coupled with frequent, painful urination, writes Health 24.